Here at Duke Orthopaedics, we're looking for ways to help people who have some mild to moderate osteoarthritis that want to be comfortable and active and try to avoid a knee replacement or prolong that need as long as possible. And these are mesenchymal stem cells where we take the cells from your own body. We either harvest them through our fat or bone marrow, process those in a simple way, either centrifuge or filtering, and then inject them back into joints or muscle and tendon injuries. We've felt good about doing this because we know our body has the ability to heal itself. We're using our own cells, in the case of the mesenchymal bone marrow and fat, to do these procedures. And so people are looking for ways to have their own bodies heal themselves. It's actually a simple lipoaspiration where we take just fat, usually from the buttocks or flank, and centrifuge that down or filter that, harvest those cells, and then inject them. One thing here at Duke, we do all the injections under ultrasound guidance because of the accuracy. We want to make sure that we're in the joint. Yeah, most patients when they come and want to know more about this procedure, they ask, what's involved, how long does it take, and then how long will it last. Looking at 3-year data show that 70% noticed improvement in activity and decreased in pain. And so we've been doing that for the past few years and having some decent results with following these patients.